Modern Rock 98.7, I'm Randy Syke. Joining me in studio, we're going to knock out two birds with one stone here today. I needed to do my 6-month checkup with Dr. Polomsky from Wilmington Eye. So, Doc, while you're in studio, welcome. Thanks for coming in.
Thanks for having me.
Also, can you look, how are my eyes looking? Did you bring your little light?
I did not bring my light, but I'm looking at them right now, and they look pretty good.
I mean, it's your handiwork. Thank you so much for doing that procedure. You know, I had LASIK about 6 months ago, and my first question for you is, you've been doing LASIK for a while, right?
Yeah, that's correct.
How much has the procedure itself evolved over the time that you've been doing it?
I mean, we've had several advances, especially in the technology and how we scan and do measurements of the cornea to get precise refractions or prescriptions for the eye. The procedure itself is pretty straightforward now. It takes about 15 to 20 minutes to do. You're pretty much comfortable during the whole thing. The eyes are numb. We have multiple people in our LASIK suite that are kind of guiding you, talking to you, making sure, you know, the anxiety level's low and whatnot.
Yeah, and I got to be honest, I'm a super big baby about stuff. You know, when I have to get like my labs done and the needles and they're drawing blood, I can't look at it. Yeah. And so it can be a little freaky, but again, you talk about having the people in the room with you. I'm sure over the years you've probably talked to people who maybe are like me and are like, it's freaky. So having the extra people in there and learning how to kind of ease people through the procedure.
Exactly. It's more of a conversation when we're there. And I like to kind of go over the steps. So I prepare the person. I'm saying, okay, right now we're going to put numbing drops in the eye. Right now we're going to put the lid speculum in the eye. So there's no surprises, nothing weird or anything like that.
Yeah, you guys are incredibly thorough. Like before the procedure, when you're doing your consultation with you guys, there are no surprises, as you pointed out. But if you're interested in LASIK procedure, first of all, right now for the month of February, you guys are offering $500 off LASIK. If you mention Randy Slack, tell him I sent you, you can get the discount. Now, does that come out of your paycheck? How does that work?
I guess out of the practices. Yeah.
No, I'm just kidding. Hey, Dr. Polomsky, lastly here for you. I've talked about my experience, and the procedure literally is 15 minutes. Like, I thought when you guys said that, it was just like, it's quick. It's like 15 minutes. It really took 15 minutes. What's the biggest maybe misconception you hear from people who maybe are considering LASIK or don't want to get LASIK because of whatever they think?
I think the biggest misconception is people think that because of their astigmatism or whatever prescription, they may not be a candidate.
Okay.
Now, some of that sometimes is true, but when they come in for the consult, we do a thorough screening from the front to the back of the eye to make sure that if someone can have LASIK, that they could have it safely. So most people are candidates for LASIK, but they just have to come in and do the consult.
Yeah, get all your questions answered from Dr. Polomsky and the team at Wilmington Eye. Doc, thank you so much for your time today. I appreciate it.
You're welcome. Thanks for having me, and I'm glad your eyes are doing good.
Yeah, man, they're doing great. Yeah, more than thank you for coming in. Thank you for letting me be able to see without glasses and contacts. It's kind of nice.
You're welcome.
Modern Rock 98.7.